Set. I am with the Healing Advocacy Fund. I want to thank you all again for being here today. And to kick this webinar off, I'm going to hand it over to Ashley Perales, who is joining us from Mental Health Colorado. So I'll hand it to you, Ashley.
Thank you, Tasha. Good afternoon, everyone. As Tasha said, my name is Ashley Perales, and I'm honored to welcome you on behalf of Mental Health Colorado. We are a nonprofit organization that has been advocating for healthier minds across the lifespan for more than 70 years. Our work focuses on promoting well-being, ensuring access to housing, healthcare, supports, and services, and ending health-based discrimination in Colorado. We're proud to co-host today's important conversation with the Healing Advocacy Fund, and we deeply appreciate their leadership in supporting the effective and responsible rollout of natural medicine healing centers across Colorado. Their commitment to public education, equity, and safety has been vital in guiding this work. At Mental Health Colorado, we believe that access to a full continuum of care, including innovative evidence-based approaches, is essential for individual and community health. This webinar is a step forward in ensuring that healing with natural medicines in Colorado is grounded in public education, safety, and compassion. Thank you for joining us, and we look forward to the conversation.
Thank you so much, Ashley. So I'm going to go ahead and share my screen. We do have a presentation prepared for you all today. All right, is everyone seeing that all right? Okay. All right, so a little bit of information about the Healing Advocacy Fund. So we are a 501c3 nonprofit organization. We expand and protect safe, affordable, state-regulated access to psychedelic healing for all who need it. Currently, we have teams working across Colorado, Oregon, and recently New Mexico, where they've also passed a medical psilocybin bill. And really, what working across these three states does is it allows us to be drawing insight and lessons learned from these programs as they go live. So we've had a live psilocybin therapy program in Oregon for over 2 years now and have learned a lot, and we're able to integrate that into Colorado's process and then hope to be able to share that learning with New Mexico so that this process can continuously go smoother as we move through. So I'm joined on the call by a couple additional panelists today. We've got Dr. Scott Shannon, who is a psychiatrist based in Fort Collins and co-founder of the Wholeness Center, which is a recently licensed healing center in Fort Collins that for years has also been a site for extensive psychedelic research and then holistic mental health care. And so Scott's going to be speaking from his perspective as one of the early participants in the state-regulated psilocybin therapy program. And then we also have Hannah Hetzer, who is our Impact Pilot Project Manager with Healing Advocacy Fund, who has launched our first real-world study within the state program in Oregon and is going to be sharing about that process. And then Hannah's also going to be managing the Q&A function and raising kind of urgent questions as they come up throughout the session today. So thank you both for joining us. And without further ado, I'm going to get into it. So I first of all want to hand it over to Dr. Shannon to share a little bit more about the history of psilocybin research.
Thanks, Tasha. Well, what we have is really an accelerated program of psilocybin research that's been happening. In 2000, we had maybe 10 studies, in 2010, 15, but that has accelerated to now in 2020, we had 142 studies. Last year, 495 studies. And so far this year, we're only halfway through 395 studies published in PubMed. So this is accelerating rapidly. But if we were to summarize the research in psilocybin just over the last 20 years, not going back into the 50s, 60s, and 70s, what we would see is that this really was kicked off, and most people see the start of the second wave of the psychedelic revival renaissance happening with Roland Griffiths from Johns Hopkins study in 2006. Can psilocybin occasion mystical type experiences? And this was a study of, I think, 1922 patients, healthy controls, and 83% of them had life-changing experience with psilocybin in a single dose. That was followed up by Robin Carhart Harris about 6 years later, doing one of the first really profound neuroimaging studies with psilocybin, showing very significant brain changes and helping us to understand how this impacts the default mode network. And then a major study in 2016 published in The Lancet, again by Robin Carhart Harris, who's probably the leading researcher and preeminent researcher in the psychedelic medicine world. He published treatment-resistant depression, showing not only effective treatment with psilocybin, but durable treatment. And I think that's one of the things that sets psilocybin apart from other treatments is its durability. Roland Griffiths in the same year published a study about anxiety and depression in cancer patients, showing significant benefit to existential issues at the end of life. And this really opened up interest in the end of life hospice movement and the benefits for psilocybin and psychedelic medicine in general for treating end of life issues. Another important study happened in 2021, published by Davis, which compared psilocybin to Lexapro, a common SSRI agent. And what they found in that study was that psilocybin was every bit as good as Lexapro, but with many fewer side effects. And I think that really opened people's eyes in psychiatry that we've got a different model. And the difference is with Lexapro, you're taking a medicine every day. It often has numbing issues with withdrawal coming off the medication, and that the results tend to fade over time. And what they saw with psilocybin in this study, I believe it was 2 doses of psilocybin, 25 milligrams each, is that the results sustained at 4 and 6 months. I think that was as far out as they went. Then I think the other piece of data that we have that's really critical is the data from Oregon itself over the last 2 years. This is real world data. And to my mind, the piece that caught my eye the most was they delivered over 1,500 sessions last year, and they had 5 significant adverse events, 2 of them behavioral, requiring hospitalization, and 3 medical, not requiring hospitalization. So this is really, I think, a very significantly safe treatment. And because you're only exposed to it once or twice, the risk to your body, I think, is significantly lower, orders of magnitude lower than taking psychiatric medicine every day. And then finally, a study came out just this week, a few days ago, about obsessive compulsive disorder or OCD, using a 10 milligram dose, which is a fairly low dose, single dose, and they showed significant benefit at 1 and 2 weeks for OCD. Those effects seem to fade over time, and probably speaking to the fact that they probably need higher dose or repeated dosing, but OCD is such a very difficult and challenging problem to treat that it's probably not surprising. And I'd say, the takeaways that we have from these last 19 years of pretty active research is the effects look consistently durable. That's why it earned breakthrough therapy status with the FDA, with Compass, and with USONA. It looks safe. The side effects appear to be minimal and I think pretty limited. It's very well tolerated. And the other thing I think that's interesting is that it's really trans-diagnostic. It looks like it helps depression, anxiety, PTSD, OCD. And I think we're looking at a sort of a different model of care. In the psychiatric model of care, we have a suppressive model where we're trying to manage people's misery by reducing their symptom load. And with psychedelic medicine, we really move to an evocative model where we're trying to work with deep, persisting change in the psyche. And I think this is the new paradigm that's coming in with psychedelic medicine. And it's really exciting to be at this place in time where we can actually begin to use it more openly. Tasha, I'll hand it back to you.
Right. Thank you so much, Scott. And I will just note that Scott is one of a group of, I would say, 10 psychiatrists across the state of Colorado who have really closely been following the research, in Scott's case, also engaging in the research to move this body of knowledge forward, but also engaged in informing the structure of the state-regulated psilocybin therapy program. And their knowledge and expertise and experience that they bring is just so important to this process. So I want to thank you, Scott, for your involvement in that way. And also mention that, of course, it is not just psychiatrists. We've also had people from a range of different practices within mental health, psychologists, counselors, social workers, et cetera, participating in this process to inform how we do this safely, effectively, and well. And so with that, getting a little bit more into the basics of the state-regulated program. And I just want to acknowledge we have kind of a mix of folks on this call. And so for some of you, this might already be quite familiar territory, and the second part of this webinar may be a little bit more new information or more engaging. And for others, you're really just diving in and learning about this. We did gear this webinar towards people who aren't necessarily deeply familiar with Colorado's psilocybin therapy program coming in. So the basic structure of the law in Colorado. In 2022, Colorado voters passed Proposition 122, which primarily did three things. It created this state-regulated psilocybin therapy model, which is very much modeled after the clinical research that we've just heard Scott walk you through. It also decriminalized the personal use of several naturally occurring psychedelics, including psilocybin mushrooms, but also some plant-based psychedelic medicines. And so if you're hearing about people using legally, not within a regulated context, that's referencing that, the personal use side of things. There is a key restriction there that it is not legal to sell any of these psychedelics. The only way that they can be accessed within sort of a structured setting is within the state-regulated model that we're going to be describing when there's kind of an exchange of money for the psilocybin mushrooms themselves. And then finally, there are civil protections for professionals to engage in this program. And I think that's really important because in particular, there's protections for licensed clinicians to become licensed as psilocybin facilitators and to provide advice and recommendations around this program to their patients. So big picture, when we're thinking about the structure of these state-regulated models, they really are an attempt to balance safety with access. And so there's certain components that are geared towards safety and other components that are geared towards access. How do we bring the costs down? How do we support this reaching low-income people and people who may not be able to afford the relatively high price tag of the amount of hours that goes into a psilocybin therapy process? So on the safety side, you have this requirement for a 4-step process, which involves careful screening, preparation with a trained and licensed facilitator, support during the psychedelic experience, and then support afterwards, integration or follow-up sessions to process what came up during the session. All of that's required within the state framework. You also have state-regulated and tested medicine. So in this case, that's psilocybin mushrooms that are grown by a licensed cultivator, and a lab has tested them to identify the potency to make sure that they're free from contaminants. You have clear requirements for facilitator training and licensure to make sure that there's a foundational knowledge and skill set amongst the people that are providing this kind of care in Colorado's program. And then you have a lot of components to support transparency and accountability. And I think that's really key to emphasize because, as many of you know, a lot of people are starting to seek out this kind of care in the so-called underground. And there have been more opportunities for that in Colorado with decriminalization. And while that can be incredibly beneficial, it's also really hard for clients to know much about who they're working with. There's very little quality control to ensure that they're getting accurate information about their personal risk profile. What are the potential effects of psilocybin? Is the right dosage being administered? And all of these can significantly impact the safety profile of these experiences as well as the outcomes. And so built into the state program are many components to really support transparency and accountability, that clients have information about what this is, who they're accessing from, and how they can follow up if they do have an adverse event, or also if there's a issue that comes up with their facilitator. So outside of a regulated system, it's really hard for people to know if something happens that's harmful to them, where can they turn? Now we have a structure where they have supports in place. So that's all kind of on the safety side. On the access side, it's important to note that there are no qualifying conditions. There's no prescription required for adults 21 up to access through this model. We are talking about cultivated mushrooms and extracts, so not synthetic versions of psilocybin. Clinical licensure is not required to become a trained and licensed facilitator, and I think that's kind of key to note, and we'll touch on a little bit later how that connects with the access and cost considerations. Group sessions are allowed in addition to individual, one-on-one sessions, and then remote preparation and integration are allowed in this model. So again, this 4-step therapy process, really key to understand that this is integral to anyone accessing through the state regulated program. The state is licensing 4 types of businesses: healing centers, cultivation, manufacture, and testing. And then you have DORA, Department of Regulatory Agencies, licensing facilitators and facilitator training programs. And then we have 2 types of facilitators in Colorado. We have clinical facilitators. That's somebody who is separately licensed to diagnose and treat. So that's therapists and doctors fall into that clinical category. And then we have facilitators who do not hold a separate license that allows them to diagnose and treat. And the baseline education for both of these groups is the same. There are some accelerated options, particularly in cases, for instance, where a clinical facilitator's training to get that clinical license may overlap with the required facilitator training. But by and large, the recognition is that there is a certain skill set that's required to support safe facilitation, and everyone who's participating in this program should meet that baseline. And so in terms of what the baseline is, there's a requirement for 150 hours of coursework at an approved training program that's licensed by the state, a certification in basic life support, 40 hours of supervised practice, 30 hours of which must occur in person. And then once somebody has completed all those steps, they can then apply for and receive their training license, which does allow them to start practicing as a facilitator while they complete the last step, which is a required 40 hours of consultation with somebody who has more experience facilitating with psilocybin mushrooms. So that's the baseline. And I really do want to emphasize that that really is a baseline. Best practice is to continue learning and advancing in this field for many years. And so this is kind of the state minimum for people to be able to engage. So all of this is now a live program in Colorado, which means that clients can reach out to healing centers today seeking access to psilocybin therapy. And as of today, last I checked, we have 14 licensed healing centers across the state. And you can see on this map, there's pretty solid statewide distribution so far, fewer in the more rural areas. And I think that's kind of natural as we think about some of the cost challenges around this. But we are seeing some appearing in the mountains, of course, quite a few across the Front Range, and then even one in southern Colorado in a more rural area. And we do expect this to continue to grow as the program gets up and running. So I want to pause there and just have an opportunity to dig in a little bit more with Scott around really what it's like to be practicing in this state regulated program. Recognizing that you are just kind of getting your clinic off the ground. But Scott, I'm hoping that you can walk us through what happens when a client reaches out to you for care in this program. What does that process look like on your end as a practitioner?
Well, right now, the way it looks is someone calls in and the front desk has a screening instrument that they walk through with the person who's interested and gets a sense of their safety, applicability, sort of fit with the system. And then depending on where they come through on that screener, for example, if they seem maybe they're actively suicidal and unsafe at the moment, we might refer them to an emergency room or some sort of urgent evaluation. Maybe we would provide that. And I should say at the outset that we're a little unique in the state of Colorado, is that we have an active full spectrum mental health clinic, which is co-located with a healing center. So we've been providing psychiatric care for 15 years, and we're adding a healing center onto that, to our integrative holistic care model. So we're a little different, but once they go through the screening process, they're then routed to a clinician The clinician will assess them again using more sort of clinical tools and interview, and then begin to track them into scheduling them as a fit in the program. And right now, our model typically the state mandates one prep, one administration, one integration session, total of 3 sessions. And in our experience working in harm reduction with psilocybin, we think that maybe for some people that's not enough. And so depending on their severity, their abuse history, their psychiatric history, their medication load, we may recommend more sessions, either in prep or integration or both, around the psilocybin session. But once that is then scheduled, they're scheduled with a provider at our clinic who's licensed, and they may be attended by someone who has a in training license. So there might be co-therapists, 2 therapists. In our work with MDMA and with LSD, we found that it's really important to have 2 therapists. It's really useful because someone needs to go on a break, someone needs lunch, someone needs to go to the bathroom. It allows for a little bit more fluid exchange between the therapists where you're not really trying to provide minute-to-minute coverage with one single person. And by using someone in training, we don't add anything to the cost. So they would go through the administration session, integration section, session a day or two later, perhaps then another or even a third integration session in the following week or two. And so that's kind of what the process looks like for us. And, we have a range of different facilitators. And so we're able to try to match them with someone who might be a good fit. But it's complicated. The state has required a lot of forms and a lot of reporting around details. And I think it's an attempt to keep safety and monitoring high. And we appreciate that. But it's not a simple process.
And I do want to just jump in and emphasize that across those 14 healing centers and growing, we will have different models, and some of them are far more clinically focused, and some of them, may be more focused on experiential or, ceremonial approaches. And so there is going to be a spectrum really intended to be geared towards what is the client coming in for, what are they seeking from this, and also what are they dealing with in terms of their mental health and health history. And so I think Scott or Dr. Shannon is really kind of representing a little bit more on the clinical end of the spectrum, although I don't want to pigeonhole you to that. But what I would say is common across all of them is, regardless, it's important to identify if somebody does have these family history or medical or mental health factors that could put them at higher risk, whether they're seeking to address a mental health issue or not. And along those lines, Scott, we have a couple questions in the Q&A here. One question, how appropriate is this for older adults? But I think kind of tying into that, could you speak a little bit more to who might be, thinking about what is kind of a person who might be a right fit for psilocybin therapy? And then are there people that you would kind of recommend against for this particular option?
Okay. Well, in terms of older adults, I resemble that remark. So I can say that older adult is not a contraindication. And certainly, our experience in working with different psychedelic agents, clearly up to the age of 75. And I think there's been some harm reduction sessions with people in their 80s. Sometimes the dose needs to be increased as people age. And one of the things that we found in the research is that older adults often don't have as intense of a psychedelic experience, but their benefit is the same. So there are differences with older adults, and we have to be aware of that and manage for that. And certainly with older adults, we run into more medication, blood pressure, issues that we just need to manage and be clear about. So who is best able? One of the most interesting things I saw about the Oregon data was this mix of why people presented for treatment. And what's interesting is about half of the people were for clinical indications, depression, anxiety, trauma, substance use. And about half of the people were for personal growth, wellness, creativity, openness. And I think once again, it's getting to that sort of transdiagnostic picture that psychedelics help us get in touch with something that's deeper within us that can benefit both the depressed patient and the pretty highly functional patient who just wants more growth, more spiritual awareness in their life. So I think it's easier to say who's not a great candidate. I think if you're dealing with chronic psychosis, probably not a good picture or fit right at the moment, probably need to be stabilized. I think if you have a very severe abuse history and you've not done any psychotherapy for that, in my experience, that can be a tough fit. People with severe PTSD who've not done other types of treatment might not be the place to start with psilocybin. Um, and so there's only a few caveats. And those people, it's not a permanent contraindication or exclusion. They probably just need to do a little bit of conventional psychotherapy to get their bearings, to find out more about their past history, and provide some stability for the session. Because I think if you go into a psychedelic session with too much trauma load or too much unprocessed trauma, then it can make for a very difficult time. That's not to say that it might not be healing or helpful, but it could be very, very difficult. And we just find to set up some baseline work where people get into that first and then move into psychedelics. So that's my thinking. I think in active substance abuse, we want people to have some period of sobriety. And I think that's a little bit of a moving target depending on the substance they're working with. But I think that's also a challenge that needs to be addressed.
Thank you, Scott. That is super helpful to hear about. And I think one thing I want to emphasize is that the screening process that is built into Colorado's program is designed and intended to make sure that these types of factors are taken into consideration and that people are directed to somebody who does have the appropriate training and skill set to be able to support them during this experience as well as afterwards. And part of how we're thinking about balancing the questions of safety and access is thinking about care teams as well. And so it is possible as this program develops and evolves and we get more information that there may be a point where somebody who's really specifically skilled with the facilitation piece and has kind of all of the qualities to really support somebody in regulating during that process and coming through it is working as the facilitator. And then you have kind of the more holistic care team on call ready to provide support in the weeks and months following. And so I think, we are in the process of learning a lot about this program and how we best support safety while trying to make something that can be accessible, recognizing that, as you've alluded to, overall, for many people, psilocybin does have a strong safety profile. And it's a question of how do we manage and mitigate the risks that we know can come up, especially in relation to the possibility of destabilization or challenging experiences. All right, so we've had a number of questions in the chat about the licensed healing centers themselves and can people access a list of the licensed healing centers? And the answer to that question is yes. So with Healing Advocacy Fund, we have created a directory of licensed healing centers. Essentially, we are asking people if they would like to opt in to share their contact information and a link to their website, and then we are posting that. And so I've asked Hannah to share that through the Q&A, but we will also be sending out a slide deck of the presentation after this webinar, which does include the link to that Healing Center directory. In addition to that, there is also the state licensee lookup tools that you can use to look up kind of basic information about licensed healing centers. But unfortunately, as of now, the state is not offering a comprehensive directory. So we are relying on healing centers to opt in to be included on that list. We are hoping that in the weeks and months ahead that the state will also create their own directory opt-in list. All right, so we've got a number of other questions in the chat, and I do want to invite you, Hannah, if anything's jumping out at you as you're reviewing those questions, feel free to kind of go ahead and direct those to Scott during this conversation.
Yeah, great. There was one follow-up question about the mental health and health screening tool, and whether it's standardized across healing centers or if it's up to each individual healing center to build that.
So the state, in particular DORA, are creating standardized required forms for all healing centers and facilitators to use. Those forms have not yet been released. So what we do have is we have a screening form that was developed by a group of mental health and medical providers, mostly affiliated with the UC Health and Anschutz campus, that created a model screening form that they shared with the state of Colorado during the rulemaking process. And that form is available online. And so those healing centers that are starting to operate today, my understanding is that they're relying on that screening tool as the baseline. And in many cases, I think that the first movers in this space are really taking a lot of precautions, so may go even above and beyond that. And DORA is going through the legal process to finalize those standardized forms, and we are very hopeful that they will be available in the near future.
Thank you. Can I ask one more question
Yeah.
for Dr. Shannon right now? There's still a number of questions about contraindications and concerns. So if you would touch on whether you think this is appropriate for folks with personality disorders, people who have disassociation responses to stress, and people on a lot of other medications, that's just still coming up.
Yeah, I think there's very few what we would call absolute contraindications with psilocybin. So I think there are what we would call relative contraindications, meaning you really have to assess a little more deeply. For example, if someone has a very remote history of one single acute psychotic event, that seems much different than ongoing and chronic psychosis. With a personality disorder, these are sort of adaptive problems that people have. Those really have to be assessed individually. And so certainly not a automatic exclusion, but it's something that would make us think a little more deeply about that. People's attachment issues, early on attachment issues, people's history of trauma, a history of dissociation. None of those is an absolute contraindication, but we would want to look at that more deeply. So if someone has a mild obsessive personality disorder, not an issue at all. Very mild narcissism, not an issue. If someone has a severe borderline personality disorder with a lot of trauma and dissociation, we would want to think about that very carefully, and they might need a very long ramp-up period, in our view, to be safe, to build relationship with their therapist, to feel safe, to create what we call a container of safety, rapport, and connection.
Thank you. And then we can move the rest to the final section, but if you would just finally comment on any perspective on folks that are in the age range of 21 to 30. This is for people over 21, but we've had a few questions about people who are kind of on the younger side of that range.
Once again, I don't think that's a contraindication. I mean, in some ways, if they're just doing it for personal growth, they should be lauded for that they're looking after themselves. I think just as with younger people, they may not have as many internal resources. We want to make sure they have external supports and resources. Their support system is well connected. And once again, I don't think, I mean, obviously you treat someone who's 22 different than you treat someone who's 82, but they're humans, they're unique. We deal with them as a one-off and sort out what they need to feel safe and to reach their goals.
Thank you.
And I know I've been talking a lot about the screening piece, but I do think it's really important for folks to understand. And so one more context around that. So not only is there a requirement that all clients are administered this screening tool when they reach out to a facilitator or healing center, but if certain risk factors are flagged in that tool, then there is going to be a requirement that they either work with a clinical facilitator for whom that risk factor is within their scope of practice to diagnose and treat, or that they complete a consultation and risk review with a licensed healthcare provider, again, for whom that risk factor is within scope of practice, and then take the learning from that consultation and risk review, bring that to the facilitator, and there has to be an informed consent process around whether to move forward with that particular facilitator. And so really the way that this program is structured is to make sure that people like Scott, people with that kind of expertise, are brought in to do these evaluations, because as you're probably picking up from listening to him speak about this, it's pretty complex and there's a lot of factors to consider and balance. And so one of our goals with Healing Advocacy Fund is also to support healthcare providers in Colorado and outside of Colorado as well to become more educated about psilocybin therapy. What are those risk factors? So even if you're not thinking of being a licensed facilitator yourself, maybe you're a primary care doctor, if your patient is coming to you with questions, how can you help them navigate that? And recognizing that, we are still learning and we're still growing our evidence base to understand how these different factors can interact and inform what really is the right care model, the right dosage, the right support for somebody to most benefit and minimize the risk from this experience.
And I would say that we're roughly trying to break people into three very rough categories as we assess them. And one group is very low risk, no psychiatric mental health history. They may be on a spiritual quest. They may be curious. They may want to explore. There may be certain things they're looking for, creativity or motivation, but they're functional. They have not a lot of, past history, not a lot of trauma, or at least the trauma has been well addressed and they're very comfortable and functional. Those would be low risk patients. Then there's moderate risk patients, people that might have mild to moderate psychiatric problems, might be on one or two psychiatric meds, some issues, some history in the past, but managing pretty well in their life. And then we have a higher risk group, or risk might even be the wrong word, higher acuity, higher intensity of issues. And these are people that might have on and off suicidal ideation. They may have severe depression. They may have problems functioning in their life at all. They may have a significant trauma history. They may not have a very good support system. So these are people that we would sort of manage very delicately, where in the low end people, they would be able to go through the sort of the state mandated system, one, and one pretty easily. So we just think about it in different ways, that different levels of intensity or acuity in the struggles people present with create a different pathway for us in how we care for them.
Okay, I do want to make sure we have time to talk a little bit about the costs and access and research considerations. So I'm going to go ahead and share my screen and jump back into the rest of the presentation, but we do hope to have more time to engage with Scott in this Q&A at the end as well. So with that, is everyone seeing my screen and not that spreadsheet? Good, great. Which I realized was, I think, a spreadsheet of the Licensed Healing Center. So not the worst spreadsheet to appear for you all. All right, understanding costs. I'm sure many of you have questions about how much is all of this going to cost. And there is no sugarcoating that this kind of care is expensive, that there are barriers, especially for low income people, to be able to access this care. And it's a challenge because we know that in many cases, there are people that are low income who could really benefit. And so there's questions of how do we make this accessible? And I think, to preface this, the reality with these state programs is it's not necessarily going to be widely accessible for low income people right out the gate. It is really, how do we work towards affordability and accessibility in an ongoing process? How do we search for solutions to bring this to a broader swath of the population, recognizing that we have to start somewhere. But with that being said, thinking about cost, why does this cost so much? So I think you're probably starting to get a sense as you hear about all the different factors that go into just screening and just making sure that you kind of have the right care and support plan for someone. But then in addition to that, you're really talking about 8 to 10 hours of a trained and licensed facilitator's time with this person. And that's a minimum. In many cases, with higher complexity comes more significant time requirement to best support people. So if you're thinking about a licensed therapist at $150 an hour, just for that 8 to 10 hours, you're talking about $1,200, kind of on the low end, and not, thinking about an individual session. And unfortunately, but it's the reality, insurance is not currently covering this. So that right there is a huge barrier. Um, and so, that's a given. That's what we're navigating. What are the opportunities to bring down costs? So I think it is always important to highlight we are talking about impact that can be significant and durable from, in some cases, just 1 to 2 sessions with supportive care. And so it's important to keep that in mind. I mean, we've had research, I think a study came out recently that was showing still significant benefits 5 years out from the kind of clinical administration of psilocybin for depressive symptoms. And so it is important to think about this kind of over the scale of what we're talking about. And of course, more research is needed to bear that out and understand exactly how long lasting is this, what kind of regular support is needed to maintain those benefits, all those types of questions. We do believe that pre and post session support in many cases can be covered by insurance. And so there are models where you try to kind of limit the formal official prep and integration as much as possible and have everything else be therapy on the front and the back end, where really like people are working with their either clinical facilitator or maybe their regular therapist who's trained and informed about supporting integration to support that ongoing care. We're also looking at, some healing centers are going to offer sliding scale payment options. There are some groups that offer scholarship support, which I will touch on in a later slide. And then also group sessions can be a way to reduce the costs. And so Colorado's program allows up to 4 participants to 1 facilitator as the maximum ratio. And again, it's going to require careful analysis as to what people are coming in for, what their needs are to make sure that that ratio is the appropriate one. I also think there's opportunities to support integrated care teams, as I kind of alluded to before, sort of segmenting out who's involved at which stage in the process to best support people, peer support models and how they can support kind of ongoing integration and care, community integration groups. All of these are ways to sort of build off of the foundation of the psilocybin experience itself to help maximize the benefit over time at maybe a reduced cost. And then, of course, the long-term goals are insurance coverage and institutional investment in this, which is what brings me to the conversation around real-world research, which is a huge opportunity in this program. Before I get into that, though, I do want to highlight the Sri Eckert Foundation has a psilocybin access fund that is currently providing scholarships in Oregon. Anything you see on purple here is linked in the slide deck, so we will send this out and you can go check them out afterwards. And then here in Colorado, we also have Althea that offers a forward fund where applicants can self-report well-being and financial stress and then be entered into a weighted lottery system that also can provide scholarships based on financial need. And then they also host a facilitator directory and support with matching clients to appropriate facilitators and healing centers. So a couple of resources to look into on the access side. But getting into the real world research question. So there are a number of really incredible studies happening right now in Oregon's live program. First of all, SB 303 data, so that's statewide data that's giving us a snapshot of the program. Dr. Shannon, sorry, I'm very used to calling you Scott. No, I'm gonna try to say Dr. Shannon. Dr. Shannon referenced earlier the number of sessions, and I actually wanna offer a slight kind of correction there. So it was over 1,500 sessions last quarter, so in Q1 of this year. Total since the program launched, there have been over 10,000 individual client sessions, we estimate. What we do know for sure is that 27,000 products have been sold in the regulated market, but in many cases that reflects, multiple products are sold per session. So that's where we're getting the estimate of 10,000. And then there's been 13 instances of emergency services being called. And there's no instance where emergency service being called resulted in death or, as far as we know, really serious detrimental outcomes. And so that's one piece of data that we're getting from the statewide data from Oregon. There's also the open study, which I'll touch on in the next slide. Individual service centers are launching their own research. So bendable therapy, again, these are all linked if you want to look into that. They're doing a study on the clients that are going through their model. There's a low-income group psilocybin-assisted therapy for depression study that we have findings from, which is really exciting. I'll share out in a moment. And then finally, at Healing Advocacy Fund, we have launched and implemented a pilot for people struggling with alcohol use. So all of this is happening. All of this is starting to inform how we understand client care considerations, but also building that evidence base and deepening our understanding of really how are people being impacted, for how long, and how can we compare the costs of this to other modalities of care? I'm going to have to rush through this a little bit. So I'm just going to say the open study is an ongoing study that facilitators and clients can enroll in. And that is looking long-term pre and post scales, assessing a whole range of different indicators. And so definitely check that out after the session. The low-income group psilocybin-assisted therapy for depression study was recently finalized, and you're going to be hearing, I think, a lot more about this study in the coming weeks, but I got permission from the principal investigator to share just a little bit of the findings from that to give you a taste of, I think, how this research can inform questions around cost and access. And I want to give a shout out to Dr. Matthew Hicks, who is the PI for the study. So inclusion criteria for this study, it is adults in Oregon diagnosed with major depression disorder, income 200% below the federal poverty level, certain factors around stability of housing, and current engagement in psychotherapy, and then some exclusion criteria. The care model is looking at 2 group prep and integration sessions done online and 2 group psilocybin administration sessions, of course, done in person. Kind of interesting note, the participants in the study could choose their own dose within a safe range. That's really different from what you're going to see in the clinical research. And I think it speaks towards a potential opportunity in real world research to actually design care models that are a little bit more responsive to the needs and the context of the individual. It's not going to give you the same type of data, but it is still useful data for when we think about how do you really best support client care in these programs. And then it's important to acknowledge that it does not include a control group. So there's limitations to this research. They did in the study look at expectancy effects. Here's the range of kind of questionnaires that they looked at. I'm not going to get too deep into it, but the 2 key ones here are the PROMIS 29 and the HAM-D, looking at the depression symptoms. On the feasibility side, 19 of 20 participants that started the treatment finished the program. No serious safety issues were reported, so that's key. Participants reported really high satisfaction, 4.8 out of 5 on average when asked with their satisfaction with the experience. And then on the outcome side, depression scores dropped significantly. And so looking at that HAM-D scale, you found a significant improvement between the first and second dose, statistically significant, and an R of 0.87, which is pretty, showing substantial improvement. And then the PROMIS 29 also showed that some of the measures of well-being were significantly improved. So in particular, looking at anxiety, fatigue, and social functioning. So here's a chart that just gives you kind of a snapshot, looking at the depression in particular, and showing the changes there. And I know I'm moving through this quickly because we're running out of time. I want to caveat, I'm not doing justice to the study. There's a lot more there. It's kind of a teaser. But a key point that I want to raise about this study is that the cost of all services, so we're talking about 2 psilocybin sessions, was a little under $2,000 per participant. And that's, again, including 2 preparation and 2 integration sessions done online and in groups. And I think that, the key piece to emphasize here is we can start to look at what is the cost saving of this type of intervention for this group of people relative to other interventions that we have available, and how can we continue to build off of this. And so thinking about the findings, of course, the outcomes in terms of depression are important, but I think it's also really important that there were not major safety events. And so again, informing how we develop these care models moving forward. So with that, I will hand it over to Hannah to speak a little bit about HAPS study.
Thanks, Tasha. And I'll just try to go through this quickly so that we still have time for the other components. But as Tasha mentioned, the state-regulated model just offers an amazing opportunity to collect observational and real-world data on how people actually use psilocybin outside of the context of clinical trials. In Oregon, we've had over 10,000 people go through the state-regulated model, which is more than all people enrolled in all clinical trials combined. So it's just an amazing opportunity to look at the different impacts of this. And especially to look at how psilocybin sessions and therapy look like for specific populations, and offers kind of the ability to design a model keeping the needs and wants of those specific populations in mind. So we at HAF started our pilot program with a pilot for people who are struggling with alcohol use and binge drinking. And we partnered with a contract research organization and with a licensed service center in Oregon called InnerTrek to put 20 people in 3 cohorts of around 6 or 7 each through the Oregon model. And we will be tracking them for 12 months afterwards. And we identified alcohol use as, a particular need in Oregon. There's a lot of people who struggle with this. And psilocybin therapy has shown promise in this regard in the clinical trial. So we wanted to look at what this would look like in the real world setting of the Oregon program and also figure out, what is the best model of care for these folks? Are there things that we might need to build around this or advocate for? So we took in a lot of input from different stakeholders to build the care model for this group. And so what we did is sort of Oregon's model is just, at the minimum one integration, sort of one prep, one administration, one integration. For this group, we did a hybrid where people started with one individual administration session and then followed up a month later with a group administration session because we heard that people who do struggle with alcohol use can get a lot of benefits from being in community with others, but we also didn't want to start people immediately with a group session. And so each of those administration sessions had both individual and group prep and integration sessions on either side. The doses ranged and were chosen by the facilitators depending on, individual needs. They went through a rigorous health screening, and these individuals all scored between 8 and 30 on the audit score. So we had a range of people from kind of moderate to more severe alcohol use disorders. They all kind of finished their care model last month, and we are going to be following them over a 12-month period. So we'll have initial data in the fall to share. But I just kind of wanted to talk about some of the, anecdotal data that we already heard from facilitators that were involved in this pilot. And they really talked about how this particular population seemed really engaged in the process of psilocybin therapy. A number of them had never used psychedelics before. And one common theme was that most of them used the psilocybin sessions not to identify or address their daily drinking, but to really go deeper and identify the root causes and the trauma that pushed people towards problematic drinking. Problematic drinking, and a number of them already reported to their facilitators reduced craving and reduced drinking. So we also kind of on the challenging side heard from 2 people that they kind of felt anxious about moving from the individual administration session to the group administration session. And so that's also something that we want to learn about and track for particular populations, like what is the ideal care model. So yeah, we are going to be tracking them over 12 months on a range of different substance use scores and cravings, mental health, and well-being. And I'll be excited to share more about those results in the early fall.
Thank you, Hannah. And I'll just note one more access piece in relation to these studies is that, there are people that are really wanting to further our understanding of care models for these different indications. And so it is an opportunity also to find funding to directly fund access for people to go, to be able to access through the program. And so there's kind of a happy meeting of our immediate goals of like, how do we make this accessible for people? And then building towards a longer term goal of how do we incentivize institutional buy-in and investment as we build the body of evidence around this modality. I am really running out of time here, so I'll just mention very quickly that there is an exciting Medicaid pilot taking shape in New Mexico, which is going to explore the possibility of dedicating some state, not federal, Medicaid dollars to psilocybin therapy. And I think that again ties into the potential of this research to shift and make changes moving forward. I'm far from an expert on that, so I've just linked it here in the slide deck. And then really quickly, some follow-up resources for providers. So do want to plug, and there's a link here, this CMECE course for licensed medical providers about managing medical risk in patients seeking psilocybin therapy that we collaborated on with the Psychedelic Medicine Association. Check that out, get some CE credits, and develop your capacity to support your patients in navigating this new program. A number of other resources through the Healing Advocacy Fund. So again, that Colorado Healing Center directory. We also have a training program directory. Sign up for our newsletter. We have some first client films that actually document clients going through this process in Oregon. So those are real world documentary films. A media resources page with one-pagers about what this program is and is not. An Healing Advocacy Fund YouTube with additional webinars like this one. And then again, those informational web pages. One resource coming soon is a client education guide where we are compiling the wisdom of a lot of people that have extensive experience in safety and support within psychedelic care to help clients better prepare for and understand what is psilocybin therapy, is it a right fit for them, and how can they best navigate this program. So stay tuned for that, please. And then I just want to highlight the state agency websites. Definitely take a look at these as well. You can search for licenses within the state programs there. Again, you'll be getting this slide deck after today. There are complaint forms for if any patients or clients have issues, they can file a complaint with DORA, they can report a concern with the Department of Revenue. All of this I think is just really important for providers to know about and have access to. So that does bring us to both the end of our presentation and unfortunately the end of our scheduled time. And I just want to acknowledge that I need to do better with time management as I plan these. I am good to stay on for a few more minutes for folks who want to stick around. I see there's a lot of questions in the chat. Just want to check in with, if including our presenters, if people need to hop off, do feel free to do so. And I just want to thank you so much for joining us for this period of time. And then if you want to stick around, we can maybe try to get to a few more of these questions before we wrap.
I'm good for 10 minutes, Tasha.
Okay.
Thank you, Tasha. I'm going to hop off. Thank you, everyone.
Thank you so much, Ashley. Appreciate you guys. Oh man. All right. Well, Hannah, I know you were just presenting, so you might not have questions to pull up.
I mean, there were a couple of questions. I sort of like chunked some of them. And so the first chunk of questions has to do with the healing centers. So 3 questions on that. How long is the, regular treatment sessions that are offered at the healing centers? On average, how many rooms, and are they renting out rooms to licensed facilitators? And a question that for the ages, which is, are there enough clients to support the 14 licensed service centers that are coming online?
Oh, there's a lot there.
Yeah. So on the first question, the state does have minimum time requirements for a session based on the dosage. So 2 milligrams of psilocin and under, which is intended to be a microdose, so a subperceptual dose. The minimum requirement is 1 hour for a session. It then moves up to 3 hours from a dose between 2 to 10 milligrams, which is like a lower, maybe moderate, depending on the person dose. And then anything above 10 milligrams is a required 5 hours for the session. I will caveat that by saying, though, there's also a requirement that the person stays until, they're no longer obviously experiencing the effects of the psilocybin, and that it is also at the discretion of both the facilitator and the participant to identify. So those are minimums, not maximums, and it may go longer. Anything to add to that, Scott?
Yeah, exactly. I think with high dose, 25 milligrams, which would be roughly maybe 3.5, 4 grams of fruiting bodies, that we often go to 6 hours, and doses above that, which we might call heroic doses, we might even go to 7 hours, but it's all case dependent. And some people will have a very mild journey that we underestimated or overestimated. So we just have to sort of go with what happens. But for most people, it's 5 to 6.5 hours. That's most people.
And then in terms of the number of rooms at a healing center, it really varies. So one of the things we advocated for in Colorado on the flexibility side is to allow what's called a micro healing center. And that basically there's a smaller limit on the amount of psilocybin that can be stored on site. But the goal was to make it possible for even individual therapists or small practices to be able to add psilocybin as a modality. And so you will have a micro healing center that might just be really a therapist's office. And then, of course, you got on the other end of the spectrum, a little bit larger facilities that may have 4 or 5 rooms that are really focused on providing psilocybin care as their main focus. So it definitely ranges. They also can be integrated with other modalities of care. So for instance, there's a healing center in Breckenridge, shout out to TLC Acupuncture, which is a micro healing center at an acupuncture clinic. And I do think that they're trying to make that accessible so that other facilitators can rent access to the space, thereby creating an option for people in that part of the state, which is fantastic. So a whole range. And then also the sessions can take place indoor or outdoors. And so we might start to see some sessions in more natural spaces within certain safety parameters. So there have to be clear kind of signage and boundaries for what is that outdoor space, no obvious hazards, access to indoors if it's needed. So really there is going to be a decent amount of variety. And I think those are all part of the considerations when providers and also clients think about what is a right fit for them. On the third question, is there going to be enough demand? So I think, I don't know that anyone really has an answer to that question at this kind of early stage in the process. What I would say is that we've done a lot of work in Colorado to be engaging and educating the healthcare community. And we are hopeful that as this program gets off the ground, that providers are going to feel like they have the resources to have real conversations with their clients about whether this might be a right fit for them in comparison to other options. And so I think we'll see how that impacts the demand side of things. And that is a pretty significant distinction from Oregon, where up until recently, there was a very clear separation between the mental health field and the psilocybin therapy field. That has recently also changed in Oregon with passage of their recent Senate bill, which did allow for more integration and does protect clinicians to have these conversations with their patients. And so I think both in Colorado and Oregon, we're going to see how the demand side of things evolves as the public awareness, comprehension, and understanding of the process grows.
Thanks, Tasha and Dr. Shannon. A few questions on the facilitation side. One, can you talk about the rationale for having a non-clinical license alongside a clinical license? And then are the licensing bodies for licensed social workers and other clinicians issuing any guidance or coordinating with DORA to minimize risk to the clinicians and then also just provide guidance on this with their patients?
Well, I think the rationale for having facilitators and licensed clinical facilitators was to give improvement to access and really try to keep costs minimum and to open this up as a program. So I think we're always on this teeter-totter between safety and access. And obviously price figures into that as well. And that's going to be on the access side. So the more scrutiny, the more sort of training people have in terms of the depth of their degree or whatever you might say around that, that's going to affect pricing, that's going to affect, but also maybe their experience and background and ability to pick up risk or intervene as needed. So it's a challenge. It's non-medicalized. You don't need a prescription. I think that's an interesting step forward, and I think we're just going to learn as we go.
Yeah. And I want to add one piece to that, which I feel like we've maybe underemphasized a little bit on this webinar, which is that all of the psychedelic medicines that we're referencing, including psilocybin mushrooms, have been used within indigenous, spiritual, and cultural contexts for thousands of years. And so there is a body of practice that exists outside of our medical frameworks that to a large extent has also informed our understanding of the healing potential of these substances. And so that was in part also why we structured the program this way, recognizing that there are people that don't necessarily have a Western medical background who have been facilitating in other cultural contexts with from what we know, a really strong safety kind of profile as well, and people experiencing significant benefits. And so there are a range of kind of different approaches within this field, and limiting it to just clinicians could prevent those, those people that have different training and background from participating. And then also sort of does not necessarily acknowledge the contribution that that has made to our understanding of how to support safety in altered states of consciousness.
Thank you. I'll put another question until you tell me not to, but there, given this is a new program, are there any efforts to convene the licensed service centers to share best practices and learnings with each other? And the follow-up was, is HAF interested in convening that if it doesn't exist?
We actually already are. So yeah, we are convening a Google group where licensed healing center representatives can be in communication with each other directly, as well as HAF. And then a monthly Zoom call. And this is modeled after what we've done in Oregon with the service centers there. So my colleague Heidi Pendergast has managed this in Oregon. And it has been really helpful because we are learning so much as these programs get off the ground. Honestly, the opportunities for learning are just absolutely endless. And even if people think that they're an expert in this field, they might be surprised by some of the real world kind of experience and knowledge that's coming out of Oregon already, in terms of like the extent of challenges that can arise. And so it is really important for people to be in conversation. So we've already got that up and running. It's a little challenging because the state is not sharing contact information for the healing center. So we're relying on our personal network. I think so far we've gotten, I want to say 13 out of the 14 centers to opt into that, and still trying to reach that 14th center over in Westcliff. So if anybody knows the folks in Westcliff and wants to put me in touch, please go ahead and do so.
Should we go on, Tasha? I know we're at 10 past.
I think we can give it a couple more minutes and then, yeah, we should wrap it up. Appreciate those of you who have stuck around with us.
Okay, great. So two questions on cost. One, is there liability insurance for clinical facilitators? And two, does medical insurance help cover any of the costs?
Well, I will say liability insurance is an ongoing challenge in this field. And, I'm sure Dr. Shannon can speak to this as well to some extent. The basics are that there are some options. They do tend to be expensive, and it's really important to look carefully at the policy to make sure that you're actually protected. Because what we saw, especially in the early days in Oregon, is some policies be a whole policy, and then I had one line that would say, like, this policy is not valid if you're breaking any federal law. And engaging in this program is still federally illegal. And so that makes the whole policy not effective. And so, like, I'm not a lawyer, this is not legal advice. Do make sure that you look at any policy very carefully to make sure that it does actually offer protection to you. And then Healing Advocacy Fund, we're compiling a list of policies that we know are out there. We are not vetting them. We just don't have the capacity to vet them. But we can make that list available to folks to do their own vetting process. Anything to add to that, Dr. Shannon?
We're still looking at a couple different policies, and interestingly enough, some policies are looking to underwrite all of our professional liability, including the conventional liability malpractice that we've had for, 10, 20 years. So it's interesting. It's evolving quickly. We hear there's going to be a new entrant in the field in January that hopefully will be improved and practitioner centric. Right now, it does look expensive and limited options.
So let's see, there's more coming in here. Are there any lawyers or law firms that have experience in clarifying legal risk?
Yeah.
And yes.
So the first place I like to point people is the Psychedelic Bar Association has a great list of lawyers, so definitely take a look at that. And then there's a few, really solid folks in the field here. Vicente LLP. We work closely with Josh Capel, who's a senior advisor with HAF. Sean McAllister at McAllister Law Firm are a couple that come to mind. Emerge Law Group has been very active in Oregon, and then I believe also practices in Colorado. So those are sort of three off the top of my head. And anytime I'm listing law firms or other ancillary services, I just want to again emphasize that these are not, specific recommendations, and it's important to do your own vetting as well.
Thank you. And I'll just point out that Yuri Blokin wrote this in the comments, which is helpful, that the National Psychedelic Association is working now to launch a liability insurance offering specifically for Colorado healing centers. So check that out. And then let's see, there are a number of distinct questions. Tasha, is there a good resource that goes into the detail about how to become a licensed healing service center? Maybe you could share that out after the call.
Yeah, and so we've done a number of kind of different webinars that talk through more on the provider side. We will also be sharing our, I cannot, in this slide deck, we'll link to our training program directory. And really, if you want to become a licensed facilitator, it's making sure that you've completed the state approved training requirements. And then if you're looking at becoming a licensed healing center, for instance, without being a facilitator yourself, you're going to want to be checking out the Department of Revenue website, which has a whole bunch of informational resources for you. Again, that is linked in the slide deck, which we'll be sharing out after the call.
Thank you. And then maybe one person was asking for the clarification on psilocybin and if they're familiar with sort of how ketamine therapy works, like the difference in the models, if you're just like briefly able to touch on that to clarify any kind of confusion.
There are different categories of medication. Ketamine is a dissociative anesthetic, and psilocybin is a classic psychedelic. So they're different in that way. In deep ketamine space, people really aren't able to move or talk or participate in the world. That tends less so to be the case with psilocybin. Psilocybin is a longer experience. They both impact the default mode network. They both appear to have significant benefits to neuroplasticity. The mood benefits of ketamine appear to be shorter lived and less durable. With psilocybin, they're longer lived and more durable. So those are some basic differences.
Thank you, Dr. Shannon. And I see that Hannah has to hop off, so thank you so much, Hannah. And I do think it's probably a good time to wrap this up. Thank you all for your wonderful questions. Noted, we should maybe schedule these for 90 minutes in future. And thank you, Dr. Shannon, so much for joining us and sharing just your wealth of knowledge with this group of people. Really appreciate you. And thanks, as always, to Mental Health Colorado. Reach out, follow up. We are here to support you in providing resources and education around this program. Thanks, everyone.
Thanks, everybody. Bye-bye.